OneMedical property is a specialist healthcare estates, what we would call partner. So we partner with all sorts of different organisations who are involved in the delivery of care. And we evolved from a real passion about helping create great care environments for those who work within them and those who use them, so patients, service users and their families. What we do is we design, we build and we invest in healthcare estate, predominantly in primary care, and then working with other partners such as local government, councils of all kinds and other healthcare providers and general practices, general practice groups to understand the need that they are trying to fulfil through their property requirement. For us, it's very important that care facilities are built within the environments and the areas that people who are accessing them are able to get to in an easy way. If it's an existing building, we'll be looking at how we can tweak the existing building. It could be a complete remodel, or it could be something as simple as repurposing some clinical spaces and working with the practice to help them understand how they could use space in a more flexible way that enables other providers to come in and use that. But it all drives from what is the need of that population and taking our time to really get to know those who are going to be using the spaces or who already use them, and those who are going to be touched by it. So not just the people who are coming in and out of a building, but the communities who live alongside it as well. We are unique in the fact that we are the only NHS care provider property combination in the country. So that brings an unrivaled level of experience, of capability and knowledge that we can then share with those that we are delivering our building solutions for. So whether they are NHS care providers, hospital trusts, GP practices, practice groups, the knowledge that we have around how care actually hangs together, because it is complicated. We understand how they all collect together. That then enables us to properly create real solutions through the built environment, whether it's a brand new building or a refurb, that help bring providers of care and the services that wrap around that into one space and help break down barriers. We work with all of those providers from a point of understanding their need, bringing our experience to bear, and then acting as a facilitator to bring all of that knowledge to a positive outcome for them, so that the spaces we design and the places that we create for them truly meet all of their needs and help improve the outcomes for those that use their services. We are independently owned. We've been building buildings and delivering care for nearly 2 decades now. We can make decisions quickly. We're very tenacious. We're very personable. We're a small but dedicated and committed team that's flexible and wraps around our clients whatever form they take. And we find that that approach helps unlock some really tricky schemes. So we've delivered a lot of schemes that others haven't been able to deliver, because we take that sort of person, organisation, place-centred approach, but also take our time to really understand it. One of my personal sort of go-to catchphrases is stay curious. So be curious, always be learning. So we don't profess to know everything about everything. We're always looking at exemplars in the UK and across the world for how estate can really help create great care environments, great work environments, places where people can be well as well as get well. And one of the things that we're focusing on as a team at the moment is sustainability and all of the different creative approaches that are wrapped around that. So there's some very sort of traditional approaches that all developer investors within the healthcare space have to apply, which is, for example, high environmental accreditation such as BREEAM, but we're now looking at working with academic partners on evaluating the true impact of our buildings on those who use them and come into contact with them, and we start that evaluation before we've even built the building. What we do can be very complicated, and these projects can take quite a lot of time to come to fruition. Even if it's simply purchasing a building, there are processes and procedures that you have to follow, and even they can eat into the time that a GP practice or a care provider partner has. So our approach is always to take those kinds of processes away from our clients. So we manage everything from the legal process to talking to the Commissioner, which is often NHS England, but not always, to get the right sign-off at the right time and to involve everybody, all our stakeholders at the right stage of the process. Each area will have different user groups, what we would call as equality reference groups. So those who may have mobility or access issues, we want to understand what they want from the building, but we also want them to feel involved in the project right from the beginning. Some of that is obligated via the planning process, so you have to engage with your communities as part of your design and access statement in the planning process. We would do that anyway. We always have worked really hard to involve as many people as we can in the projects, from a simple sale and lease back to a more complex remodel or complete new build. Building better healthcare for us is effectively what it says. So it is using our skills as designers, as developers and healthcare investors and healthcare providers to deliver care environments that are designed around the individuals who use them, so that when you interact with that space, it helps you feel as healthy and as well as possible. We've always tried to be as innovative as possible in our buildings, and if you look at our track record, both as an investor in buildings that we've bought in, but also those that we've designed and developed, they all look different and they all respond to the needs of the area and the environment in which they sit. And we want to build on that in the next iteration of OneMedical property. We're adding new roles in to really help us understand the impact and to measure evidence the impact of our buildings and our strategic partnerships that we are building with larger place builders, not just those who deliver care, but those who are delivering residential spaces, who deliver infrastructure such as schools, working alongside them to be their specialist healthcare partner. So if you're creating new spaces, new places for people to live and to be, health is part of that. So how do you create healthy environments both inside and outside of buildings? So that's our next iteration really, looking at how we can use all of our learning, evidence it properly and build that into a blueprint for the future of healthcare.